Hey everyone, my name's Jessica and I'm a second-year doctoral student studying nursing practice, and today we're going to talk about how the NCLEX works. So it's important to understand how the NCLEX works because it gives you an advantage when taking the exam because you understand what's going on in the computer system. So NCLEX is a computer adaptive exam, and what this means is that the computer and the test adapts depending on how you answer questions. So when NCLEX starts, it gives you a relatively easy question, and it starts you off at this baseline. And as you answer questions correctly, you will slowly rise up above this baseline. And as you get questions wrong, you will then drop back down, and you may go up below and above this baseline throughout the exam. As you rise above the baseline, the questions get harder, and as you drop below the baseline or start to get those harder questions wrong, the questions will then get easier. So what does this mean? This means if you're midway through your exam and the questions are really, really tough, that means you're doing really well. If you're consistently getting select all that apply or fill in the blanks and things like that, that means that you're probably above the baseline and you're doing really well. So keep that in mind. Don't let it psych you out if you get to question 35 and you've gotten 10 select all that apply in a row. That just means that you're doing good. When you reach 75 questions, 3 things can happen. Either 1, the test turns off, and it will turn off for 2 reasons. First is that you've done so well and you've consistently answered questions above the baseline, and the computer decides that this person knows their stuff, they're ready to become a nurse. The second thing that can happen is that you've just have not reached that baseline so consistently and you've just dropped so low that the computer says there's no way that this person is going to be able to come back up above the baseline to where they need to be to pass and become a nurse. So we're going to turn the test off because it's not worth it. Number 3 is that the test will continue and you can go all the way up to 265 questions. And what this means is that you just kind of haven't reached a high enough amount of questions right to turn the test off, but the test could turn off at 90 questions. It could turn off at 110 questions. It could turn off at 175 questions. It's just when you reach that point of answering enough correctly or incorrectly for the computer to decide either this person's ready to be a nurse or they're not ready at this current time, and then turns the test off. What to know about the questions for the NCLEX is that you have 6 hours to take 265 questions. What this means is that you have about 1.3 minutes per question, which means that you should really take about a minute a question. Don't sit on a question for 5 minutes because you don't know the answer. Just take a guess and move on. The other thing is you cannot go back. So once you answer a question, it's finalized and you can't go back to it. And once you've answered it, don't worry about it. Don't let it stress you out. Just keep moving forward. In nursing world, there's so much information to know. You can't possibly know everything, and you're probably going to get some questions wrong on the NCLEX. That's the way it works. So something else to keep in mind is that not all questions count towards your final NCLEX grade or you're passing up the NCLEX. There are a handful of questions which are test questions for future exams. So what they're doing is they are testing these questions out on current nursing students to see how many get them right and how many get them wrong to decide if this would be a good question to put on future exams. And the last thing to keep in mind is that 88% of people pass NCLEX on this first try. So if you prepare adequately and you can manage your anxiety, you have a really, really good chance of passing NCLEX. Most people that I talk to that don't pass on their first try usually let the anxiety get to them. It's not that they haven't prepared adequately. I think most students know to prepare adequately for nursing exams, especially NCLEX, because that's the big one. So just when you're in the exam, don't let the questions psych you out. If you're getting hard questions, remind yourself that they're difficult because you're doing well. And just keep moving forward. So if you want to learn some strategies for taking NCLEX, check out my other video. I will link it up above to help you guys with that. And also check out down below. There's a lot of resources for you guys. I have an NCLEX study guide down there and some other goodies. So definitely check those out. And if you like this video, make sure to give it a thumbs up and subscribe below. And I'll see you guys soon. Bye.